While it is too early to make a definitive analysis of the progression of the disease in South Africa, there is sufficient evidence to show that the lockdown is indeed working. While we recognize the need to expand testing to gain a better picture of the infection rate, this does represent real progress. The measures we have taken, such as closing our borders and prohibiting gatherings, as well as the changes that we have had to each take in our behavior, have definitely slowed the spread of the virus.
Let's welcome you tonight, and thank you so much for joining us here on Unfiltered on Channel 404. I'm Desiree Chauke. Today marks 25 days of the national lockdown aimed at curbing the spread of COVID-19 and mitigating the number of casualties emerging out of the pandemic. But it's a moving target. So many news stories coming in today, but the big one being those oil prices that are plummeting. It's a big story. It's related to the fight, the global economic challenges in the fight against COVID-19, but also the global responses to COVID-19. So there's lots to speak about. We're talking tonight to the KwaZulu-Natal Premier Sihlezi Kalala. Today, he went out into eThekwini on roadblocks to try and encourage the inhabitants of eThekwini to stay at home. We're also talking to Professor John Stremlau, a visiting professor at Wits University, is also on Skype. We also have as well Professor Adrian Purin. He's the head of the Center for HIV and STIs at the National Institute for Communicable Diseases. And on the line, we also have Dr. Nkonji Sibati. She's the CEO of the Innovative Pharmaceutical Association of South Africa. IPASA will be talking to all of those guests tonight. But let's start now with Professor Stremlau. Professor Stremlau, very good evening to you. Thank you so much for joining us this evening.
Good evening, Good evening.
Now, IMF boss Christina Georgieva has called this crisis a crisis like no other. Yet, as we speak tonight, Australia is calling for an investigation into the origins of COVID-19. America is threatening withdrawal of financial support as President Donald Trump questions the intentions of the World Health Organization. Is this good for a global community that is looking up to governments for answers?
Well, it is not, of course, but this is, as you suggested in the opening, an unprecedented situation. We were forewarned about viruses and the fact that they could affect all of us in different ways. But this COVID-19 really comes with such suddenness and is so unknown that governments are really and profoundly at a loss of what to do.
Professor Stremlau, I'm going to ask you to hold on to your thoughts there. Seemingly, we have audio difficulties. We're going to try to sort those out and come back to you as soon as we're able to. Let's take a break. You're watching Unfiltered.
Today, I'm instructing my administration to halt funding of the World Health Organization while a review is conducted to assess the World Health Organization's role in severely mismanaging and covering up the spread of the coronavirus. Everybody knows what's going on there.
The United States of America has been a long-standing and generous friend to WHO, and we hope it will continue to be so. We regret the decision of the President of the United States to order a hold in funding to the World Health Organization. With support from the people and government of the United States, WHO works to improve the health of many of the world's poorest and most vulnerable people.
Welcome back. Let's now welcome on the line the Chief Executive Officer of Innovative Pharmaceutical Association, Dr. Konji Sebati. Dr. Konji, a very good evening and thank you so much for joining us tonight.
Good evening, Desiree. Good evening to your listeners.
You have previously been quoted as saying that your motivation behind joining the 25-member organization was mostly because there's a need for harmony between pharmaceutical companies and governments. Do you think that that need for harmony is heightened now as the world seeks answers to COVID-19?
Indeed. Well, it was already improving quite a bit. And of course, with this crisis, it has heightened and will continue on this trajectory as we move forward post-COVID.
How is the pharmaceutical industry impacted by the indecisiveness of governments, for argument's sake, the USA and Australia, questioning the validity of the processes of the World Health Organization? Does this create division in terms of decision-making?
Not at all. The industry is focused on finding a vaccine. We don't get into the politics. We listen, observe, but we are hell-bent on finding a vaccine against this virus. And the industry is working, our company researchers worldwide are working tirelessly on finding a vaccine. Unfortunately, as research and development goes, there's a very long process, so we're not promising anything tomorrow, but because we have to ensure safety and efficacy of the product, and that safety is not compromised. So there are a lot of programs that are ongoing in spite of what governments or in particular certain governments are saying, but we just focus.
Ordinarily, pharmaceutical companies are, by their nature, are global animals, but you're based in South Africa. What are the chances of a solution coming out of this region?
Unfortunately, we don't. All our companies based in South Africa, the 26 companies based in South Africa, do not do research at that level. We do participate in clinical trials, but the numbers and the patients and the data that we get here, we then feed onto the international hub. So actually all of the research is done internationally, but we participate in contributing to patient numbers and data and that kind of thing. But we are, to your question, we as South Africa or South African pharma will not tomorrow come up with a product that we would say was produced in South Africa and researched in South Africa and produced in South Africa. We're part of a global network.
Having said that, just take us into some of the conversations taking place amongst your membership in terms of the effort to find solutions to this pandemic.
Well, first of all, I must say that the industry, as you can imagine, is competitive. However, this is one time, in the time of being in the industry, I have never seen such collaboration. Pharmaceutical companies are sharing information. They have opened up their compound library for anybody to go in there and find compounds that they can research on, working with academics, working with government. So this has been actually unprecedented that the industry has worked so much together in this manner. And all they're focused on is finding a solution soon. We have several clinical trials that are ongoing right now. We have promises from some of the companies, to mention two, Roche and Abbott, that hopefully by end of May, we may have new antibody tests that have been researched and developed.
So on the one hand is the testing research, on the other hand is the vaccine. How does one weigh against the other in terms of your work?
Sure. The research is for vaccines and for diagnostics, and that's happening in parallel. So those are not competing. Those who have expertise in diagnostic in the diagnostic area are going forward and looking at all sorts of diagnostic tests, particularly rapid tests for resource-limited countries and ourselves here. And the other group that is looking at the vaccine, at finding a vaccine to combat the spread of this virus.
What sort of gaps has this outbreak exposed in terms of research and how effective it is?
One thing I'll say is that the gap, if I may call it a gap, it's that this virus is new, completely new. So there is no diagnostic out there, there's no vaccine out there, there's no treatment out there that's available for this vaccine. It's completely new. It's very, very different from the SARS and the MERS that the world experienced a few years ago. So everything is kind of starting from scratch. However, because we have some experience from SARS and MERS on the diagnostics, it's more looking at treating what was done and developed for those two viruses and how it can then be adapted to this particular virus now.
Of course, another conversation that's taking place globally at this time is economic impacts. But one imagines that in the pharma space, it's a boom at this time as there's more and more need for pharmaceutical products.
We are not seeing it as a boom at all. In fact, none of the industry is even talking about what the benefits, the financial or economic benefits of this pandemic are. Not a single company. Nobody's talking intellectual property. Nobody's talking about ownership. Nobody's talking about what they may benefit from it. All of them are focused on just finding a new treatment and a new diagnostics and treatment. So on that score, I don't think any ethical pharmaceutical company right now would be thinking of this as a boom.
Absolutely noted. Dr. Konji, we're talking to you tonight as the CEO of the Innovative Pharmaceuticals Association, but you also have a history. You're a former ambassador to France, to Switzerland, to Portugal, and this pandemic has a global impact. What are your thoughts about how the developed world has been found wanting in terms of being able to curb the spread of COVID-19?
It is an interesting question, and I would really not like to go in that direction of comparisons of what they didn't do well, what they did right, or whether
just your general observations.
My general observation is that this virus was creeping onto people. It was stealth, and it was just like, growing around you as you're tackling this and thinking, could this be? It was all over the place. So I think it caught a lot of governments and academics napping, if I may use that word. So it is how, I guess, countries then responded after the fact. Nobody anticipated it. Nobody anticipated the extent of the virus. Maybe some anticipated the virus, but didn't anticipate the extent and how they would respond. So people have been stumbling along, as they go on. And I think, I would be remiss to not talk about our country that, thanks to the leadership of the president, the minister, they were quick in action and taking measures. So we were not ready as such, but as soon as we got onto it, we were very decisive about our actions. So that has helped a lot, I believe.
Are you happy about the efficacy of the lockdown process?
I'm absolutely happy. And supported any part that supported wholeheartedly.
All right, we'll continue to talk to her, Dr. Konji Sibati. She's the Chief Executive Officer at the Innovative Pharmaceutical Association. But let's just go back to Professor Stremlau. Our line broke as we were talking earlier. Prof, thank you so much for rejoining us. But we're talking about the global community that's looking up to its governments for answers as countries like the USA start to question the work of the World Health Organization, and Australia starting to put, they announced tonight that they're putting in place investigations to find out what the real origins of COVID-19 are. Does this help?
Well, it have to be done eventually. My real concern is that this unprecedented threat that has caused the kind of response that was very quick and forward-leaning that President Ramaphosa did here was not matched in any sense by what Donald Trump did in the United States. His response was very political and very shambolic. It was very confused. And as a result, you have all of these deaths, now 10 times the number in the U.S. over China, whereas China took a different approach. Governments, however, don't have many options. They can only do the quarantine and close down, and at the same time try to, while they're calling on their people to isolate, provide some degree of social cohesion for those same people. But they can't really attack the enemy, which is the threat right now of coronavirus, because it is unseeable and unknowable. It only can be really beaten by a vaccine, and that will require international cooperation led by the WHO. So that's the outlines of the international regime, which is yet to be really tested and tried out. We're in uncharted waters on this.
Your thoughts about the work of the World Health Organization in efforts to stem this pandemic?
Yes. Well, the World Health Organization, there has been a global commitment to try to deal with pandemics since 1851, and the World Health Organization is post-World War II, of course, and has really distinguished itself very well over the years. But remember, it's an intergovernmental organization. So this question about whether or not they coddled the Chinese or allowed the Chinese to be obscuring what was really happening in Wuhan have to be sort of talked about eventually. But right now we're facing a war. All countries are vulnerable, and the WHO at least has a global appreciation of what's happening where, but it's also a clearinghouse for new vaccines and coordinator. And we really need that in Africa, because Africa runs the risk of not getting vaccines when they're developed or other therapies. Africa is extremely vulnerable. It's the latecomer to this pandemic. Yep. And so therefore the international community has to be more responsive, and I think will be for its own self-interest, but the WHO should be the clearinghouse for this. It shouldn't be competitiveness between one power or another power. It should be a collective effort.
Prof, you're speaking about Africa. Think tank Analysis Africa says the virus outbreak poses great danger to African countries that do not have robust health systems. What's your diagnosis of the different health systems on the continent and the ability to withstand this virus?
Well, you see, it's worse than that, because there are 54 separate countries, still sovereign. They are all being afflicted by this coronavirus in different ways at different times. And therefore, we really have to have a central clearinghouse, which President Ramaphosa, in his appeal to the African Union virtual summit, made plain. But we're still in the very early stages of this, and it's really difficult down here to know what, say, is going on in Burkina Faso or Niger or Nigeria or wherever, and that will be clearer in time, but we can't fool around. We have to be working on this now, and that's why I'm very glad that President Ramaphosa made an effort to try to get collective efforts going, and then to get donors to coordinate through the WHO. And I'm afraid that Donald Trump and the Americans won't be terribly helpful in this regard. but they are contributing to the efforts down here, and they in small ways. And there was just a story about that today, another $8 million. And I think we can learn a great deal from our experience with HIV/AIDS and international response. But so far, we just are beginning to understand what we're up against.
Although South Africa is leading in terms of sub-Saharan Africa in the number of infections, North Africa, your Algeria, your Egypt, your Tunisia are leading in terms of deaths, the number of deaths. Why do you think, do we know why this is the case?
Well, of course, because they're closer to Europe, and this virus has been imported everywhere except for China, because that's where it started. So it makes sense that they would have cases, but there's nowhere near the number of cases that there is in Spain or Italy. And now in the United States, there's 700,000 cases in the United States. It's exploding. At least in South Africa, which was hit by this virus, President Ramaphosa was already in late January beginning to get prepared for this, and I think has handled it extremely well in the first stages, which is the need to lock down and separate so that the virus can be slowed. Now we're struggling, and we're waiting for Cabinet to tell us about what we'll do about the simultaneous economic crisis, which is really as dangerous in many ways as the COVID virus.
So we're getting reports this evening of protests in the U.S. Against stay-at-home measures. President Cyril Ramaphosa has on several occasions praised South Africans for submitting to this new order and staying at home. But some cracks are starting to show. How far do you think South Africans can stay on course?
Well, I hope they can continue to do as well as they've been doing. And let me make a very important point in this. I think we all South Africans trust President Ramaphosa to have our best interest at heart. He's human like the rest of us, and he may make mistakes, but he's been very transparent and accountable. Donald Trump has been just the opposite of that. He has been changing his mind, not being transparent, lying about it. You know, the Washington Post estimates that 16,000 falsehoods and misleading statements have come out of the man since he became president. So you can't trust him. And in America, there's a lot of polarization over this whole handling of the virus, because the pandemic, because they just can't get confident that the government knows what it's doing. And frankly, having watched this very carefully, I don't think the United States government knows what it's doing. But when we have the kind of briefings that we get from President Ramaphosa and from Minister Mkhize and Professor Karim on what this virus means to us in a scientific sense, then we have at least the confidence that they're trying to do the best they can. And that also allows for some social cohesion. That's going to be tested, because this virus, while it afflicts everybody, it afflicts them in different ways. And the poor and the crowded, overcrowded townships, as we all know, are extremely vulnerable. And so that's why I think by buying time, he's now on the right track to try to get these 28,000 trackers into the townships and to try to find out how to contain and isolate and quarantine so that we can continue to contain it, waiting for what we really need is the weapon of ultimate destruction, the vaccine.
We're talking to Professor John Stremler. He's a visiting professor at Wits University. Also earlier on the show, we spoke to Dr. Konjisi Bati, the CEO of IPASA. Also later on the show, we hope to speak to the Premier of KwaZulu-Natal, Sihle Zikalala, and also Professor Adrian Purin, the head of the Center for HIV and STIs at the National Institute of Communicable Diseases. Let's take a break.
In the first few cases that we had were people who were travelers who had been all over touring various countries, and they actually have access to medical aids and so on. So a large number of tests were done in the private sector. And later on, the numbers that were coming from public sector was very minimal. At that point, of course, people who were in the public health services did not have as much of exposure to the infection. So, but as time went on, now that we have been out there, talking to communities and screening them and so on, we have actually increased the numbers to the extent now that we've got the figures that we're showing.
Well, that's the Minister of Health there, Dr. Zweli Mkhize, as you were hearing from Professor Stremlau earlier. President Cyril Ramaphosa and Health Minister Dr. Zweli Mkhize being applauded for their swift and decisive action. But we continue to have this conversation here on Unfiltered, and the question we asked you tonight was, is South Africa on track to defeat COVID-19 pandemic? And we'll be looking at some of your tweets as we continue. But let's bring back again Professor Stremlau into the conversation. Professor Stremlau, what are your thoughts about the lockdown, the regulations? What would you have different? As you said earlier, that the president was providing leadership, but it doesn't necessarily mean he's perfect.
No, the problem is that there's nothing really more that any government can do other than to organize its people to quarantine themselves and then to begin to test as much as they can and track as much as they can so that they can figure out where the leakage is as we reopen the economy. And the big question facing South Africa now, of course, is where does it go next? But I do want to make absolutely clear that among countries that I've been following, South Africa was the most proactive in moving quickly, and in a time when it was extremely difficult because of our financial situation and because of the diversity and inequality in this country. It's not like Korea, which is very homogeneous and very developed, relatively speaking. So that I think that when the history of this pandemic is written, there will be a very laudatory chapter for at least the first phase, and I hope the second phase. But we're still now going to have to confront how do we unloose the economy so that people who can get food, who need food, can get it, and jobs who can somehow get back to work. It's going to be very, very difficult. And there's a global recession that's could be a depression. So it's going to be really challenging for this government, but so far, so good.
Literally, as I was asking you that question, new statistics came in from the Minister of Health, Dr. Zweli Mkhize, on Twitter saying 20 April 2020 COVID-19 statistics in South Africa, 121,510 tests conducted, 3,300 positive cases identified, 1,055 recoveries, and 58 deaths. That's the latest statistic. That big effort of flattening the curve. What are your thoughts about this progression, Professor Stremlau?
Well, it's always difficult to know what's around the next corner, but the relative degree of success here, 54 deaths. America has 41,155 as of today, and now America is a bigger country than South Africa, but it certainly is proportionately doing a much poorer job at trying to flatten the curve. Donald Trump has not provided central leadership the way President Ramaphosa has. And of course, it's a complicated 50-state union. But I think that Minister Mkhize, while he's concerned about the increase, of course, and has to be, it is a reflection, again, that in South Africa, we've gotten ahead of that pandemic so far. And yet, there is going to be more and more revelation and positive people who have contaminated other people. So we've got to be very, very careful and wear our masks and do our washing.
The big conversation now globally being the reopening of economies and how this is going to be carried out. What are your thoughts in this regard?
Well, this is the problem. Every government is going to deal with their situation differently, and yet you do need to have a central clearinghouse because we're all connected so that One of the things I'm worried about for Africa, for example, is that if, given the weak systems we were talking about before, if you continue to have infection spreading in Africa, then other countries will embargo African travelers, and African trade and cooperation becomes more and more difficult. It is a global problem, and the way in which each country does its testing and tracking and quarantining those who are positive becomes very, very important, and we should learn from each other. And I think we can, but that's where something like this question between the Americans and the Chinese becomes such a distraction to me. The battle is really with coronavirus, not with each other right now, and there have to be a sharing of information and more transparency and more accountability. That's I hate to fall back on those issues because you're asking me a very complicated question. I'm trying to be brief.
You have all the time, Prof. But what you're warning of is reportedly already taking place in China, the blockage of the movement of Africans in terms of suspicions about the origins of COVID-19. Where is a solution going to be found? We saw about 2 weeks ago ambassadors, African ambassadors based in Beijing, coming together to send a letter to both the Chinese government and the Communist Party to say this was not acceptable.
It's not acceptable, and they were absolutely right to do that. One of the problems with this current period of history is that you've got these America first, China first, India first. South Africa, you know, when the struggle for apartheid was underway, became a global issue for a common concern. And I think South Africa's voice on these issues is important, but it cannot tolerate discrimination. This disease does not discriminate among us on color or on age or gender. Older people are like me are more receptive to the disease than younger people. But that the point is that different countries have different capabilities to respond, and yet everybody has to work to stop this disease until we get a virus. Until we get a vaccine. And when we get a vaccine, then it's incumbent on everyone to make sure that that vaccine is available to everyone.
Just a quick one before we take a break, Professor Stremlau. The Africa Free Trade Agreement was supposed to kick into motion around June, July. And obviously, those plans are going to change with this outbreak.
Yes, of course, because there is this need, and this is the paradox. There's a need to be a collective effort to beat this common enemy, but the only way that we can do it is to limit the enemy's penetration. It's a network enemy. It's not like a bunch of tanks coming at your frontier, and it spreads wherever it can. So you have to lock down the borders while at the same time recognizing that we're all going to have to work in parallel fashion and try to keep a degree of trust among us, which is again why the WHO as our collective effort becomes so important, and why attacking the WHO is the wrong thing to do at this time in our history right now as we're trying to deal with this disease.
Professor Stremlau, let's thank you so much for your time this evening and your thoughts.
Thank you.
Professor John Stremlau is the visiting professor at Wits University. When we come back, a conversation with the Premier of KwaZulu-Natal. Stay with us.
The issue of tracing has improved tremendously. You would also know that tracing is an important part of the work that we are doing. And the lockdown seeks to make sure that we achieve exactly that.
We then took a decision that a team is established within the Department of Health that is going to visit all the private hospitals that we have in the province and test, look at whether they are adhering to the protocols.
We have entered another phase of our struggle of COVID. We always report of 0 death, but today we are reporting that we have a 1 death.
It's not lifestyle because it can attack everybody, including villagers. It's the areas where there's prevalence already. Of course, our testing, it's in all facilities, including facilities in rural areas. But the exposure level has not yet been dominant in rural areas.
Different engagements there by the different MECs of health in Gauteng, in Limpopo, in KZN, and in a moment we'll be speaking to the Premier of KZN, Mr. Sihle Zikalala. But let's take a look at some of the thoughts that you have sent through tonight with regards to our conversation.
On track in terms of dealing with COVID-19, but I think soon we will run out of ideas as a country. As we see, like, the numbers are rising every day, but the recoveries as well on the other side, they are promising. I think it's high time that we come with a strategy that will be long-term in terms of dealing with the COVID-19. At the same time, ordinary South Africans living their normal lives. I don't think we can be on lockdown forever.
Hello, good evening. I don't think South Africa is on its way to defeat the pandemic because of the way people are roaming around the streets. People are all over the streets, so there is no way they can defeat the pandemic, you know. So I would suggest, if it is possible, a proper shutdown is very, very possible, and that was the one which was going to rescue South Africa from this dangerous pandemic.
All right, we'll take a listen to more voices as we proceed with the show. Right now, though, let's go to KZN. The Premier there, Mr. Sihle Zikalala, is with us via Skype. Mr. Zikalala, a very good evening to you. It's been quite a busy day for you at the roadblocks. Tell us what happened.
No, thanks, and thanks for having us in your program. Yes, it has been a very busy day. We have been working hard, as we announced yesterday, that we are tightening the implementation of the regulations. We had 30 roadblocks in eThekwini as a whole, and we arrested more than 114 people who were just going there with some of them fake permits and some of them without permits and no valid reasons. And we, number of cars, I think, were suspended that were not roadworthy. And we are going to continue. It was not just a question of today only, but we will be continuing enforcing regulations because we'll want to ensure that we try to reduce the level of infection, especially in the district of eThekwini.
Premier, you wanting to enforce adherence, which is great. But on the other hand, people have to deal with economic issues of not being able to put food on the table. How do we balance this out? Is the province giving sufficient information to its citizens about why there is a need to stay home?
We are doing our best to educate our people and create an awareness, because it is not the virus that goes to the people, but it's people who goes to the virus and they fetch it to themselves. And that's why we are trying to create this awareness to all communities. It is important that people appreciate that this is done solely to protect the lives of our people in the whole country and in the world as a whole.
Are you satisfied with your activities today? Do you reckon that there will be a better adherence going forward?
We are satisfied with the intervention to what we've seen today, but we will be going on. It is not a question of one day or an event. It is something we will be going on, enforcing the regulations and ensuring that the lockdown is adhered and followed by all of us. But at the same time, we are mindful of the people who cannot provide for themselves, who cannot sustain their livelihood. And we have implored on the Department of Social Development to do everything they can do to ensure that our needy people are supported, but also supported in a very dignified manner.
Mr. Zikalala, as the fight continues against COVID-19, there are also political implications. You're also a leader within the African National Congress, and there's concerns about political disharmony in the fight against COVID-19. What is the situation within the African National Congress?
Well, I haven't noticed that disharmony, but what I've seen from the beginning was all political parties at a national level coming together and consolidating the approach to deal with COVID-19. And even within the ANC as the movement, we've been working together, of course, led by the government, the president as the president of the country. And therefore, we have seen a coherent approach under the leadership of President Cyril Ramaphosa, dealing with all issues. Of course, Minister Zweli Mkhize as the line function and Minister Nkosazana Dlamini-Zuma as the line function responsible for disaster. And I think there is a maximum coordination in what has been done so far.
Concerns, the first case in the country reported from your province and the highest number of deaths. Are you concerned about this?
We're very concerned about the highest number of deaths that are taking place. And majority comes from eThekwini district. And that's why we've taken a view that we must intensify the lockdown, but further deal with the issue of screening and testing. And we have declared the whole of eThekwini as the hotspot so that we are able to deal with screening in all areas and test those we believe that should be tested.
How far is the screening and testing process? Are you standing good in terms of facilities?
Yes, we are. I will say right now that the screening and testing process is going well. We have screened more than 96,000 people, and I think about 15,000 people have been tested so far. But the program is going on, and from now onward, our main focus is in eThekwini, where we have been seeing the escalation of the infection.
We have 2 weeks left of the lockdown. How are you intensifying your actions to make sure that they are effective within this time span?
The remaining, these 2 weeks going toward the end of the month, will see us intensifying the screening and testing. That's what we will be doing so that we'll be able to isolate those who are infected and be able to provide them with medical support and then ensure that we are addressing the issue of infection. We don't want to see any escalation of infection again. And that's why we are directly zooming into areas where we have identified those infected and the contacts so that we round those areas, be able to ensure that those who are infected are taken to medical facilities and those who are contact are tested as early as now.
We know you've had an incredibly busy day. Thanks for making the time tonight.
Thanks a lot, and thanks for having us in your program.
Zikalala is the Premier of KwaZulu-Natal. Let's now move to our last guest for tonight. Professor Adrian Purin is the head for the Center for HIV and STIs at the National Institute for Communicable Diseases. He joins us on the line now. Very good evening to you, Prof. Thank you so much for making the time tonight.
Good evening, Desiree, and thanks very much for the opportunity, and good evening to your listeners. I'm sorry that we've had some technical problems.
Would have absolutely loved to have you on Skype, absolutely. We're following a story that broke in the last hour. I wonder if you can update us on it, about the number of employees and doctors believed to have been exposed to COVID-19 at the Eugene Marais Hospital in Pretoria. The number increasing. The story says 17 employees and 6 doctors are now following guidelines by the National Institute for Communicable Diseases for healthcare workers who may have been exposed, which includes self-isolating. What can you tell us about this story?
Unfortunately, I don't have information on that specific story, but we can certainly talk in generalities about what's actually happening and what the requirements are. I think that those types of events, and I think we've seen it in 1 or 2 other hospitals, certainly raises questions around infection prevention and control. I think these are difficult areas, but I think they are really critical areas which will play a very important role in terms of our future control of the infections that we are going to see over time. I think we are in a fortunate position currently when you look at the numbers that are infected. It certainly is increasing, so that gives us some indication that there is evidence of community spread. However, when we look at the number of deaths, this is now, unfortunate as it is at about 57. So our systems with regard to high care areas and intensive care units are not being overwhelmed at this time. But it's really important that as we come towards the end of the lockdown period, that we are actually in a good state of preparation for us to be able to manage those particular cases that will come through. So yes, we have very good policies in place, and I think it's really critical that we use a risk-based approach in order for us to control the risks that are there. So the policies are quite clear as to the types of staff that are at risk, the levels of risk, and the levels of personal protective equipment that is required for us to carry out those particular duties.
I just want to reiterate a statistic we mentioned earlier on the show. The Minister of Health, Dr. Zweli Mkhize, tweeting the latest statistics Monday 20 April, 121,510 tests conducted, 3,300 positive cases identified, 1,055 cases of recoveries, and 58 deaths. Now, we were listening to the Director General of the World Health Organization earlier on this evening giving his latest media briefing. He says a virus that many people still do not understand. Those are the words of Dr. Tedros Adhanom Ghebreyesus earlier on. There's a lot of information and misinformation doing the rounds about concoctions that people can drink to avoid infection and what to do should you be exposed. Is there anything people can do besides what the NICD guidelines dictate in terms of getting the right information?
Yeah, so again, I'd really like to encourage your listeners to find information from credible sources. I think lots of effort has gone in through, for example, your news outlets, the Department of Health, the NICD, the WHO, and really to read those for the clear pieces of information that are critical for how we need to conduct ourselves through these particular lockdown and for the future. I think that for all its goodness and power, like Twitter and Facebook and other sources of information, they certainly play a role, but I think we need to really make sure that we're using credible sources. So currently, our main advice really is the social distancing or physical distancing, the washing of hands, the wearing of masks where appropriate. Those are some of the key things that are going to be very important for us to be able to control the virus. There is no current medical interventions for this particular virus.
Unfortunately, we struggled for most of the show to connect to you better. That's where we're going to have to leave it. But thank you so much for making the time tonight.
Pleasure. Thank you. Bye.
All right, let's say thanks to all our guests for tonight. KZN Premier Sihle Zikalala, Professor John Stremler from Wits University. You just heard him now, Professor Adrian Purin. And earlier on, we spoke to Dr. Konji Sibati, the CEO of the Innovative Pharmaceutical Association of South Africa. As we say goodbye, let's take a look at the results of our poll tonight. Right, we were asking you, is South Africa on track to defeat COVID-19? And 17.8% of you says, yes, government is on it. 48.2% of you, no, citizens don't oblige. And 34%, the numbers will tell. 2,634 votes coming through tonight. Thank you so much for your participation. Let's have a conversation again next week, Monday evening here on Unfiltered.